What I would say is I'm going to shut down the virus, not the country.
I'm going to shut down the virus.
We're still facing a very dark winter.
We got to beat it back before we shut it down.
We are looking at a winter of severe illness and death for unvaccinated.
How lovely. What optimism. Dark winter, severe winter. He said that a year ago. He's still saying it now. I don't know. Let's bring in my great friend, Bob Redfield. Robert Redfield was CDC director. We served together on the health COVID task force. Robert, welcome back. It's great to see you. And I don't get this. There's so many things I don't understand. The latest is from our friend Tony Fauci that the vaccines, see if I get this right, the vaccines will not protect against Omicron. You have to have a booster. So the vaccines don't work. But now they're saying some vaccines work less well than others. They're downgrading vaccines. And then finally, the issue of natural immunity. Nobody seems to want to count natural immunity. Bob, I mean, honestly, look, I've been vaxxed twice. I have my booster. I'm a believer in that. I don't like mandates. But I'm just saying, what works here? And we have huge numbers, as you may know. COVID cases in the New York area are skyrocketing. Not necessarily hospitalizations and deaths, but the case rate is rising. So what do you make of this?
So, Larry, I think the first thing is just to emphasize that vaccines are still our key defense mechanism, and they do work. The challenge we have is their ability to work against the Omicron variant is going to be less than the ability to work from the Delta variant. The Delta variant, they work really well at the beginning, but as time went on, they wane in their ability to protect. And that's why we had to have an additional injection. And that will probably continue. With the Omicron, it's even worse. So if I was to take my blood and measure my ability to neutralize the Delta virus or the Omicron virus, my blood will be 40 to 50 times less able to neutralize the Omicron virus. So it's not that the vaccines don't work, they just don't work as well. And it may mean that eventually it's not every 6 months that we need to get another immunization to defend ourselves against Omicron, maybe every 4 months. And this is what we're going to learn. But I want the American public to know that vaccines do work. The important thing is to get vaccinated and stay vaccinated, get that extra injection. And I suspect that we're going to need another one after that, too, until we develop a vaccine that has a more durable response.
It's going to be a tough sell. I'm not disagreeing with you. You're the scientist, but it's going to be a tough sell. Look, Bob, another tough sell is this surge towards masking. I mean, masking, which can ruin kids in school. It's very unpopular in business. People staying out of the stores, out of the office. Seriously, in your judgment, is the masking any more effective than the vaccine, for example?
Well, I think where we need to move, Larry, and we're a little behind on this, is we need to move to expanded testing. The issue is, the reason people are doing masking and nonspecific measures is we don't know who's infected and who isn't infected. We need to do expanded testing so that those of us that are infected know we're infected, we move out of the transmission pool. You know me, I'm not a big fan, obviously, of shutting things down. We need to move on. We have to live with this virus. It's with us. We have to learn how to deal with it in a safe, responsible way. Vaccination's one piece, but accelerated regular testing so we can identify the silent epidemic and move them out of the transmission pool, that's important. And yeah, mitigation plays a role, but let's put that on the judgment of the individual. I think I'm not a big mandate person. I don't think mandates are going to help us. I think they're going to push us in the wrong direction. I think, and I think shutting things down is not going to help us. It's going to push us in the wrong direction. You know that when I was CDC director, I argued on the task force against closing schools because I didn't think closing schools was in the advantage of K through 12s. I thought the public health negative consequences were substantially more. Virus wasn't being transmitted in the schools. It was being transmitted in the community. So what did we end up doing? We sent the kids back into the community. We should have kept them in school.
Robert Redfield, thank you. I want to talk to you some more. Actually, I'm going to make a pitch for you to come on the radio show tomorrow and come back on TV. You're a level-headed guy, and I trust you. That's very important. Bob Redfield, thanks, buddy. Happy New Year.